All right. Well, welcome everyone. We're so pleased you could all join us today. My name is Laura Sanchez, and I am the NACM Director of Marketing and Strategic Relationships. We'll start today with a presentation about the NACM CMC certification, the eligibility criteria, and the application process, and why you should get certified. We'll have time for questions, but feel free to pop them in the chat during the presentation as well. We would really like to get to know you, so we ask that you type your name in the chat, where you're from, and why you're on the call today. Today, we are joined by NACM's board president, Byron Cords, and president-elect Nancy Avitabile. They're both care manager certified and professional aging life care managers. So now I'm going to go ahead and turn it over to Byron.
Well, good morning. Well, or good afternoon, wherever you guys are. I can't see the slide. Oh, now I can. There we go. Thank you. Sorry. Well, good morning, everyone. I'm Byron Cordes. I'm in San Antonio, Texas, and I'm proud to have been the board chair for the last couple of years. Um, and so I think the first question that most people ask is kind of, who is NACM? And of course, NACM is the National Academy of Certified Care Managers. We are the only certification for care managers, not case managers. And we're here to support the high level of competence in practice of care management through the exam, certification, and recertification program. So next slide. And our statement of purpose, clearly you guys can read, but we endorse a voluntary certification by exam for all individuals practicing care management. And what that means is that we use an exam that tests your knowledge, and we'll get into those, but in certain realms to prove that what the basics of care management. And then that certification that you hopefully get once you pass the exam, it helps, certainly represent you as a high level of education and certification, but it also is there to protect the consumer. And that way, folks out there saying, I can do that. I'm a care manager, I'm a case manager. We can say, hey, wait, we actually have a certification in that. So the consumer knows that the person that they're working with is working at the highest level. So next slide. And I also don't have where I cut off. I'm sorry, I apologize. I think I'm still going. Is that right, Laura?
Yes.
Okay. So NACM is, as I stated, NACM is the premier organization dedicated to elevating the field of care management. NACM empowers care managers to deliver exceptional client care through our certification program. We also do ongoing education. Both NACM provides some education, but we also recognize other education out there that contributes to care management. And then we also, again, have a supportive community through all of our different certificates, through NACM. I think, we have folks that you can bounce ideas off of and all of that. So next slide. Okay. So CMC certification promotes the delivery of safe and effective care management in any practice by establishing standards of experience and knowledge required for the competent ethical practice of care management. It formally recognizes those individuals who meet the eligibility requirements of NACM and pass the exam. It encourages ongoing professional education and training of individuals engaged in care management. And the educating allied health professionals, employers, and consumers to help them make informed decisions when evaluating the skills and qualifications of a care manager. So all of those, hopefully CMC does. All right, still me, I hope.
Yes.
All right, thank you. Why get certified? Enhance your credibility. I promise we actually know what we're doing here, guys. Sorry. You can tell it's Casual Friday. So I bounced on a little unprepared. Why get certified? I definitely think I'll tell a quick story. I was one of those people years ago, 20 years ago when we were all looking when ALCA was looking at certification, and I'm a clinical social worker, and my ego, my hubris said, "This is ridiculous. Why would I get certified? I have a license." Basically, to do case management in the state of Texas. It's listed in our licensing. Um, but I will tell you, I came around. I came around about 15 years ago, and I recognized that as care managers, we don't have a specific profession. We all come from different backgrounds, right? As I think, our chat is showing that everybody kind of comes from a little bit of a different background. We come from what someone said, law, I think. We come from, sociology, social work, nursing, gerontology, physical therapy. So this certification kind of helps brings us all together. And it says, guess what? With all of this other experience that I have, this enhances my credibility with clients and my professional partners. It doesn't just say I'm a social worker who, maybe worked in child welfare, right? They don't know. So this certification certainly proves the point that I know what I'm doing when it comes to aging and disability. So it enhances your credibility with, clients and professional partners. It opens doors to professional opportunities. We hire, we in our care management practice, we hire only certified care managers or folks who will be eligible. We require that they get certified as soon as possible. Hopefully that opens job doors for others like you that are considering certification. And then it promotes compliance with regulators. There are, some hospital systems, some healthcare systems that require, their case and care managers to get certified. And so this can help with that compliance. I know there's some mental health care managers out there that do home visits, and they're required to get certified with their regulators. And so they often use NACM. Okay, next slide. That was a long tirade. Okay, still me. Is that right? Yeah, I
Yes.
figured. This is my favorite, actually. I think this one drives Nancy crazy.
It is your favorite, though.
I do, having I taught at a university for 10 years. And we offered certificate programs at my university, right? We assert, certificates. We were looking at a certificate in gerontology, certificates, but we did certificates in social sciences and certificates in child welfare. And so, universities and other places often offer a certificate of completion in care management. And I'm certainly not knocking those programs. I think there's some excellent ones out there. Especially if you come from a background that maybe doesn't have a lot of the sociology, psychology pieces of it. And so you can learn about older adults in the field of care management and adults with disabilities. And then, you take 4 or 5 courses in the aging, and then you receive a certificate um, to say that you completed, all of their coursework. And those are great. That's great continuing education, but it is not a certification. A certification, like NACM, requires a baseline education for us. That's, at least an undergraduate or a graduate degree in some form, something related to aging life. And then you must be trained in the field. So we also require that supervised work experience. So we build not only the education, and many people, nurses, social workers, as soon as you get that education, you go and you sit for an exam for a license. We're saying in our certification program, we love your education, but we also want to wait until you've had a couple, 1, 2, 3 years of experience, depending on your education. And then we ask that you pass this rigorous exam. And the exam um, is it is made up through all of care managers across the country. We have a testing corporation that runs this through all of the, all of the statistics that show whether these questions are valid or not, and really proving the point, asking the questions, and giving the answers that are correct. So I think, our test is, I think, rigorous. So why the CMC? And this one, I swear, is Nancy.
Yes.
See, I knew what I was doing. Okay.
Thanks, Byron. So I'm Nancy Avitabile. I'm also a care manager. And I've had my CMC since 2004. It's easy to remember. I took the exam about a month before I gave birth to my second child. So, and I did it because ALCA at the time, NAPGCM, was becoming much more professional and was going to have an advanced kind of advanced professional standing for those who had the certification. So that's why I did it, and I'm pleased I did, and now I'm involved with the board as well. So we're going to go back to why CMC. Well, first of all, you see we're accredited. The CMC is accredited. And to get that accreditation, as Byron said, there's a lot of rigorous kind of steps we have to follow in terms of the testing, the test prep, the relevance of the questions, etc. And there's a lot of work that goes into that. So certainly my predecessors, the folks who kind of got really involved early on when the National Association, became affiliated with NACM, did a lot of work to get us to this point. So this is huge, and it's very important. It's not just your average kind of, now I have a certification to do that. As Byron was saying, we're actually accredited. It is the only nationally recognized certification specifically for care managers. So that's important. There are other ones other ones that are more maybe for healthcare providers, nurses, and then of course, social workers. As I said, we're accredited. And not only does the certification benefit you, it benefits your clients, the patients, consumers, etc. And I just want to mention that as I was listening to Byron, my customers actually care. They care about accreditation, or not necessarily accreditation. They care about credentials. So in the last, I would say, calendar year, I've had 3 of my care managers sit for the test. 3 of them passed on the first go, which was great. And they're all licensed masters of social work, licensed in the state of New York. But they went ahead and they got that other credential. And with the next couple slides, you'll see why. But it is very important to my prospective clients, my clients and their families, that the people that work for me are credentialed. And it's important to me as well. Next. Okay, so some of you on this call maybe have registered to take the exam in the fall, or you will be, hopefully after this presentation. Sign up, all of you. So these are the exam content domains. And I probably just about everyone on the call understands these domains, and you use them in your work already. So domain 1, we assess and identify the client's strengths, needs, concerns, and preferences. This is our assessment. This is our evaluation. Following that, we establish goals. We create a plan of care. Then domain 3, and again, these are the domains. Under each domain is where you're going to find all the different questions that are related to these domains. So establish goals and plan of care. Domain 3, initiate, manage, monitor, all that ongoing execution, outcomes of the plan of care, measurements, clinical measurements, etc. And then domain 4 is promote and maintain professional standards in care management and business practices. And so when you're taking the exam, you're going to have these 4 domains and, a number of questions that relate to each domain. Next. Well, Byron pretty much said this, but I'll repeat it. So certification is evidence of your commitment to quality care and support and services to clients and families. And I mean, if you didn't already have a blueprint, this is your blueprint. I mean, the 4 domains basically are, in my opinion, what every care manager should follow. We support community-based care, continuity of care, quality of life. And of course, once you get your certificate, you'll have to keep up your knowledge. There's a profession, we're committed to professional development and continuous learning. I believe there's a certain amount, I'm going to say 45 CEUs. I think we have to have 45 CEUs in 3 years. So you do have to keep up your knowledge and your continuous learning. And as with care management, social work, and many of the helping professions, a person-centered care system, that is holistic in the approach is also the focus of the exam and having your certification. It demonstrates your competency. I was taking some notes here. Well, I talked about the blueprint. There's some other note that families care about credentials. But, it shows certainly with the test and with understanding those 4 domains that the certificate holder has understands aging and disability issues, community services and resources, chronic disease management, benefits, financing, legal and ethical concerns, special needs advocacy, and family and individual support. I mean, I'm basically reading off the slide, but that is a fact. And, again, these are very important things that care managers or case managers should understand. And, I think it is a rigorous test, actually. And we're in a stage right now, certainly with this influx and I guess silver tsunami, as people call it, of aging and the changes in the age space and the aging economy. I think that's what I heard recently. There's a lot of players there. And and so there's a lot of players out there, and not everybody knows what they're doing, but they sound like they do. And this separates you. And as Byron said, it protects the client, it protects the consumer. Am I still going, Laura?
Yes.
Okay. So it enhances your professional future, and it does identify you as someone who has a prestigious credential. And I really can't emphasize this enough. We need more people to take this exam and have this credential, because it distinguishes you from those calling themselves, loose terms. And I'm not, my intention is not to grade any of the professions, people who might do sales and things like that in the aid space or different kinds of advocates, because that's all important. Some of those people can maybe even sit for an exam like this, but it does set you above the rest in terms of proving that you have the knowledge. You understand the 4 domains. You were able to take a test to prove that you understand it, and you know how to operate from that blueprint. Again, it does attract quality referral sources. I can attest to that, and I do get asked all the time. We talked about continuing education already. And again, if someone comes to me with a CMC, even if they don't have an LMSW, but they have the CMC, I would hire them to my care management practice, because again, it tells me that they have sat for the test, they understand the 4 domains, and they already coming to me with that blueprint for how to be a productive and successful care manager or case manager.
Thanks so much, Nancy.
Yeah.
So now we're going to talk about the application process, and I just want to give a quick overview of the application process and the eligibility criteria, as these are the areas that we often get questions about. The first thing that we really want to emphasize is we encourage you to read the entire handbook. All of the information is there, and it probably has a lot of answers to any of questions that you might have. The application process is entirely online. You pay the application fee when you submit the application. So make sure that you review and meet the criteria before you submit your application. Please note, and this is very important, that your name must match exactly what is on your government issued ID. And then after your application is approved, you will receive a notification to schedule your exam with Prometric, which is the testing center. Make sure on the day that you arrive with your ID and follow the rules that they provide. The exam results will be sent to you by email approximately 4 weeks after the close of the testing window. So the October exam results will be sent probably about the end of November. So as mentioned, the deadline for applying for the October exam is September 2nd. There are no extensions, so make sure that you get your application in with plenty of time. We do not recommend waiting till that last day to get your documents in just in case there's any questions. So please submit your documents well in advance. So now we're going to talk about the eligibility requirements. So this is option A, option B, and then we have option C and D. So there are 4 eligibility options, and each includes a combination of education, supervised care management experiences, and in some cases, which are option C and D, direct client experience is also needed. Your work experience must begin after you've earned your degree. So this may determine which degree option you use for your application. So if you have your master's and your bachelor's, depending on when you started your work experience, it might determine which degree you use. So, in determining eligibility, you must be currently working in the field of care management in one or more of the following roles: direct care management practice, care manager consultation, supervision as a leader or participant, administrator of care management program or practice. You must agree to adhere to the NACM Code of Ethics, which is on the website as well. Your supervised care management work experience must begin after your degree is complete, that degree that you're using to qualify. So your supervision, we get a lot of questions about supervision. Your supervision may be formal or informal, and it is expected to include the use of clinical skills, core manager functions, record review, case examples, current practice issues, ethical dilemmas, care plan development, care management interventions, and quality evaluation measures. So your direct client contact experience can be obtained anytime in the past 10 years. NACM will consider employment experience within the last 10 years towards eligibility. So the formulas are all listed in the candidate handbook, but I'll just go over it a little bit. Full-time employment is defined as a minimum of 35 hours per week. Part-time employment can be used, and there's a conversion table in the handbook that you can use to calculate that. So your care management experience must include a person-centered, holistic approach to care that addresses a broad range of issues related to well-being of the client, extensive knowledge about the cost, quality, and availability of resources in your community. And your care management practice must include all 4 content domains, and Nancy mentioned those 4 content domains earlier. And the care manager tasks, which are under those domains, and those are also listed in the handbook. So we understand that care management practices and settings are diverse, and employments are not standard. So simply just working in a position of care management is not sufficient alone. So if you're wondering if your field is related to care management that your degree is in, some of those are child and family studies, counseling, gerontology, human services, nursing, psychology, rehabilitation, public health, sociology, social work, marriage and family therapy, occupational therapy, physical therapy, recreational therapy, respiratory therapy, and speech and language therapy. So if you feel your degree is related, but it's not listed here, just reach out. and send your transcripts along with your application to review. And if you do have any questions, we are happy to work with you or answer any questions that you might have. So your supervised care management experience and direct client experience must not run concurrently, unless it's part-time work experience. Internships, preceptorships, practicums, and volunteer activities are not accepted as employment. Okay, and these are just kind of showing C and D. And again, we encourage you to check out the handbook that has all this and more. So here are some details about the actual exam. So the exam is a computer-based test. It's multiple choice with a total testing time of 3.5 hours. The exam includes 180 scored items and 20 pre-test items, which are unscored and evaluated for our future use. The exam content is based on those content domains and care manager tasks, and was developed through a rigorous job task analysis. Our last one was conducted in 2022, and our next one is being conducted right now. Questions were created by subject matter experts and reviewed by NACM panels. The Professional Testing Corporation, which is also called PTC, they collaborate with NACM to prepare and approve the examination. So, how do you prepare for the exam? I am not a care manager, but I have been told that the best way to prepare for the exam is through your direct work and your supervised care management experience. However, there are some additional opportunities that you might want to consider to better prepare for the exam. NACM offers the CMC exam prep course, which is available on the website. There's also the online practice test, which is offered by PTC. And then in the candidate handbook, there are reference materials, and that will help you study for the exam questions. And then we also encourage you to review the NACM Code of Ethics and Standards of Practice. All right, Byron, we're back to you.
I'm supposed to shout this, I think. So what are you waiting for? Um, so hopefully, you all will sign up for the CMC certification exam, certainly today. I think Laura said it well. Really, everything is in the NACM handbook. It is a lot of information. So I will reiterate what Laura said. Make sure you read the whole thing, but maybe read it twice because I promise you, it's probably in there. That doesn't mean that staff won't answer questions. Certainly complete the application and then schedule your exam. So, definitely look at the handbook and see if you meet the criteria. Here's the contact information as well. I think I'm stealing this. No, I'm not. It's me. Yay. So contact information certainly for PTC to apply for the exam. Prometrics is our the testing site organization. And then of course NACM, where Laura and Amanda are sitting right now.